Is an acronym for Antonia Oyidamola Olakemi Afedmo Social Foundation. The foundation was founded after I lost her to TTP on her 4th episode. It was an ordinary day, and she was at work, and she called me to say, "Oh, Mom, I'm not feeling too well." At that time, they normally give a nurse a phone whereby you call them, and then they reach out to us, and then they prepare for us to come in straight away, and treatment started. But on this occasion, it wasn't like that because the nurse was away. So they gave the phone to somebody else, and that was it. The trial was delayed because the ambulance, which is the accident and emergency traffic, and they were just not listening. When we got to A&E, rather than them preparing a space for us to come in, they directed us to an A&E, and then the A&E people didn't know anything about TTP. Even though that's the hospital is being looked after, I was telling them this is what you need to look for, this is what you need to do, but they weren't listening. By the time they started treatment, she passed away 3 hours later. But things have been different right now. AOFAC Foundation is a patient advocacy support group, raising awareness of TTP. Funded in 2013, our group has grown to have presence in 3 countries. Within the USA, we have this in different states in the USA. We also have this in Nigeria, and of course, we are a registered charity in the UK. Our vision is where every person affected by TTP receive timely and accurate diagnosis, compassionate care, and improve quality of life. We envision a society where TTP is widely understood by the medical practitioners and the public, leading to a better treatment options and enhanced support for patients, family, caregivers, and friends. Through our efforts, we aim to honor the Antonia's memory, a lasting impact. Whereby there's TTP awareness, research, and patient well-being. At the heart of AOFAC Foundation mission is a clear vision, like I said. The goal where everybody affected by TTP receive timely and accurate diagnosis, compassionate care, and a fast improved quality of life. Why AOFAC Foundation carries my daughter's name, it also reflects our guiding principles. Where A, for advocacy, ensuring TTP patients are heard and their needs prioritized. Outreach, O, engaging communities and healthcare professionals to raise awareness and improve early detection. F, for fostering community support, building strong network of patients like we here, survivors, caregivers, and health professionals. A, amplifying patient experiences, bridging the gap between patient realities and the healthcare system that are meant to serve them. C, collaborative working hand in hand with institutions like OSMA, TTP Network Group, TTP Center in the UK, Dermatology Society, or Dermatology Society in Nigeria. We run seminars with them, we invited speakers and professional speakers to speak to them. Just had one last week where we have about 56 dermatologists, whereby Professor Scully, I'm sure you know her, was one that speak to them. And I'm sure some of you here have attended that program. How are we supporting you? We provide support, direct support to patients, caregiver, and facilitate peer-to-peer support online and in person. I'm sure that I saw a lady and a daughter yesterday. She was from the US and she doesn't know what to do. So she found us. So we directed her to somebody that could help her in the US. We work in the UK, we work with institutions like NICE to support the approval of new medication. And we have done that with the approval of the SUMA. We also supported the development of creating the NHS England Nice Specialist Center that Joe was talking about earlier. How we supporting you. One of our core and dedicated causes is to raise awareness of TTP. And we have been doing this and in so many ways. Apart from, sorry, over the past 11 years, we have tried to support you as our community in many ways. With a mission patient perspective, in improve care and treatment for patients. We collaborate with healthcare authorities and farmers. We work with hospital care centers, and healthcare professionals. We provide direct support to patient caregivers and facilitate peer-to-peer support online networks. We work with institutions like NICE, um, in an equivalent of LPA. We also work with National Healthcare Service, that's NHS England, as a stakeholder and have supported in the development of creating the additional TTP specialist center. When we first started, I think it was one or two, but now we have one specialist center which creates a better, closer access for patients. Our role is as a stakeholder, representing the voice of patients on matters such as timely treatment and care process. This picture is just it was last month. Yeah, last year in the United States took place in different states, which are being led by dedicated volunteers, leaders. Some people came. Some are not here this year. Were in London, in New York, in North Carolina, different states, and we'll be doing so again in September. That's one in the UK. There will be all the awareness events. Another thing we do is social, whereby we have an annual awareness for social. But what we're trying to do is where TTP patient expert can come and talk. We have always open to all, and everyone can come with their family. Their patient and caregiver have the opportunity to tell their stories. It's a fun event, and it's just a social event where you just relax, just like we did last night when we watched the ball. The game was such a fun event, and it's what we do at the moment in the UK, and last year I said we did in the US and also in Nigeria and also in the US. So we're just in this side to support you in any way we could get to have anything we are able to support you to direct you to the right space. Work is personal work is pathology work was to support you one by one. So we are fill this space to connect you and to help. And thank you for having me again. Please do follow us on social media. Um, the point of this is that we don't want TTP to be isolated. We want everyone to know about TTP. TTP is being confused with other medical issues. The symptoms are similar to other conditions. If the professional doesn't know, how will they know? How do they save life? So we know to raise awareness. Awareness is key.